I mean, it's simple. Bro. It's simple as plain. They do not want us to educate ourselves. They want us to remain in darkness. They want the scale to remain on our eyelids, and they want us to remain blind and in bondage. But when you have the power, you have the knowledge, you have the voice, you have the heart to voice that opinion or voice those facts or whatever it may be, whatever the case may be. If you have that, you have power. Once you have unity, you have power.
One thing we don't have is any official statistics that show the coronavirus toll by demographic. But in some communities, the pandemic appears to be disproportionately affecting people of color. Our national correspondent, Jerika Duncan, has been looking into this. Jerika, good morning. We heard David Begnaud report earlier today that he observed mostly black men in the ICU in the hospital where he was. Very interesting finding there. What have you found?
Well, it's no secret, Tony, that African Americans have a higher rate of things like diabetes, asthma, hypertension, those underlying conditions that we talked about that have led to the deaths of people with coronavirus. And because of that, one local health commissioner who calls racism a public health issue says she's taking the lead by collecting important information that she says could help save lives.
We're in the middle of the storm right now. We need as much data as possible. Right now, we're flying blind.
Milwaukee Health Commissioner Jeanette Kowalik is overseeing roughly 1 million residents in Milwaukee County.
Of the 40 people who have died so far because of the coronavirus in your county, what percentage of those people are Black?
Right now, it's still about 80%.
African Americans make up 26% of the population?
Correct.
Right now, the CDC is not collecting data on the race of those who've tested positive or died from coronavirus.
It's important to actually document the race of the people who are infected and dying.
Everyone will be affected by this, but there are some communities and populations that are going to be affected even more significantly.
Dr. Uche Blackstock is founder and CEO of Advancing Health Equity in New York City.
The reason why we need to really discuss this issue and to collect the racial and ethnic demographic data on who is tested, who has the disease, and on who's dying from it is so that we can properly allocate healthcare resources equitably to the communities that need it.
Dr. Blackstock also works part-time at urgent care facilities in Brooklyn.
Can you describe the makeup of the people in your waiting room right now?
We're noticing more Black and brown and immigrant patients that are seeking care. And a lot of these patients are essential workers. A lot of them are service workers.
She says testing is still not readily available.
How many COVID-19 tests are you all able to give each day?
We are instructed that we probably should not test more than 1 in 10 patients.
So 10%, exactly. No more than 10% of the people that come through there every day.
Our criteria is really, we're focusing on the highest risk patients.
CBS News contributor Ibram X. Kendi is also director of the Anti-Racist Policy Center at American University.
If we don't have an awareness right now of racial disparities, we can't right now figure out what's causing those racial disparities. What policies or even lack thereof, then we can't change it right now in the moment when people are dying and being infected.
And according to a new report by WBEZ Public Radio in Chicago, an analysis of the county found that 70% of people in Chicago who have passed away because of coronavirus are Black. And you're talking about nearly 300 deaths right now in the whole state of Illinois because of coronavirus. But definitely important information when you look at how we track other diseases, other viruses, and this being a pandemic. I'm sure there are a lot of people that are hungry for that information right now.
I'll say, Jerika, this is such an important story. We've heard this saying all the time, knowledge is power, and all of your experts seem to say that you need more information to know exactly what you're dealing with and how we need to fight it. So glad that you are raising this issue. Thank you very much, Jerika Duncan, reporting from her home, too.
Thank you.
The governor and the president also said that mortality numbers are now showing that African Americans are dying at a higher rate from the coronavirus than the rest of the population, both nationally and especially here in Louisiana. Mike Perlstein caught up with local experts to tell us why.
More heart disease, more heart failure, more kidney disease. Tulane cardiologist Dr. Keith Ferdinand reels off the risk factors that are more prevalent in the African American community. Those same factors can turn COVID-19 into a death sentence. New statistics show that while 32% of the population in Louisiana is black, 70% of the coronavirus deaths come from that demographic.
It's troubling because we need to address these disparities. It's a scar on the healthcare society that we have here in America.
Ferdinand and the experts point to a host of other reasons for a higher African American death rate, less access to health care, more people in service jobs, even cultural factors.
No shaking of hands, although we love to pound and we like to give the dap. Those things don't make sense in an environment where you can transfer the virus to someone else.
One of the leading national experts on health disparities is the Dean of Tulane School of Public Health, Dr. Thomas Leviste. He sees a striking parallel to another New Orleans catastrophe.
I think this is a second Katrina. Just as Hurricane Katrina exposed underlying inequities that have existed in this city for centuries, the coronavirus is doing the same thing.
Leviste hopes that, like Katrina, the pandemic becomes a catalyst to do more for the city's culture bearers of music, art, and food, all with deep roots in the black community.
If we didn't have this vibrant arts culture here, this city would not be special. It would just be another city.
While similar COVID-19 death rates are being seen in other cities with large black populations, the experts say New Orleans' experience rebuilding after Katrina could help when the city rebounds from this crisis. Mike Perlstein, Eyewitness News.
The experts also say similar minority death rates are being seen in cities like Detroit and Chicago, but they warn about a new wave of infections that could hit rural areas with big black populations, including communities in Mississippi and Alabama.
African Americans have more exposures. Blacks are highly represented among hospital workers, delivery service industry, in public transportation. African Americans are more likely to live in housing environments that cannot support the social distancing policies.
There's considerable and mounting evidence that shows that there are both genetic and, of course, biological differences when we think about various diseases when we compare blacks to whites in the U.S. Different types of cancer, heart disease, diabetes, hypertension, obesity, and even genetic diseases like sickle cell anemia. The disparities are real and the differences are real. Our history, our genetic makeup, and the environment. All of those things sort of play a complex role in the reasons why we see these differences.
It sounds to me that it's multifactorial, as you both might say. It's a 1-2 punch. There may be a genetic predisposition towards some of these diseases, and they are exacerbated or fueled by environmental factors.
Absolutely. That's exactly what it is. So you have a group of people that are at higher risk of infection, but they also have an underlying biology that might put them at higher risk for a more advanced and aggressive disease course. And in this type of setting where there still isn't truly effective testing, and there definitely isn't any type of therapeutic or treatment, we're in big trouble. Many of the chronic diseases, right, that affect African Americans impact our immune and inflammatory systems. So if you have higher rates of these diseases in a population or community, the consequence of that is that those people will also have issues related to their immune system and their inflammatory systems.
So are you saying basically that the immune systems generally of Black and brown people are different than the immune systems of other people for genetic reasons?
Certain DNA patterns are linked to African ancestry. Other patterns are linked to European ancestry. These genetic patterns of DNA are also linked to other biologic mechanisms, such as immune response to different diseases. And we need to understand these in order to more comprehensively understand cancer pathogenesis. And it's likely also going to be important in understanding the best treatments for COVID.
When we think about some of these diseases like cancer and heart disease, diabetes, obesity, we know that all of these things tend to influence an inflammatory response. So our immune system and our inflammatory system goes out of whack. And it's really interesting that one of the key features of COVID-19 aggressiveness is what we call a cytokine storm, where there's this dramatic inflammatory response that leads
where
to
the immune system goes into overdrive.
It goes into overdrive, and the bad thing is that it leads to tissue damage. It leads to all sorts of issues with our physiology, circulation. All of these things become affected and really makes our bodies more susceptible. Centuries of natural selection have made us who we are. But what we have to understand is that selection in one environment is beneficial. In a completely different environment, that same trait can now be detrimental. One example, the Blacks who were put on the ships for the transatlantic slave trade that actually survived the trip, they had to retain water. And the physiology that is associated with that is high blood pressure. That natural selection that occurred has shaped African Americans in such a way that we have higher rates of hypertension. In that setting, it was beneficial. However, now being in the setting of being an American, that same trait now is detrimental. And of course, one of the things we know is that one of the primary conduits for the COVID-19 virus to get into cells is the ACE2 or the ACE2 receptor, which is also involved in hypertension. And we know African Americans have higher rates of hypertension. And so the question can become, does that actually provide a better way, right, or in a more efficient way for the virus to actually affect these people?
Dr. Newman, can you talk about access to care?
Patients of color, and in particular African Americans, have socioeconomic disadvantages, such as poverty, results in a lower likelihood of receiving adequate care. More Blacks are receiving care in the urban public hospitals, safety net hospitals. These hospitals have been disproportionately devastated by the costs of COVID medical care. And so it's become a real vicious cycle in terms of worsening care in populations that have greater needs.
We absolutely have to address these underlying social inequalities and socioeconomic issues that we know are playing probably a central role in infection rates and mortality. What I'm concerned about is the lack of effort to really try to ensure we're being inclusive and that the research that is ongoing in COVID-19 will include diverse populations of people. We have to look at the actual value of including these individuals who are at higher risk of infection and worse outcomes, because what we learn from them can help improve the lives of everyone.
Tonight, Oprah Winfrey is sounding the alarm.
This coronavirus is shaking up the world, taking a devastating toll on the African American community.
Adding her voice to those highlighting the disproportionate impact of COVID-19 on African Americans in her Oprah Talks COVID-19 series.
The number of deaths is just staggering.
In Chicago, 68% of COVID-19 deaths are African American. In Louisiana, it's 70%, though they're just 30% of the population in both places. Health officials say African Americans are more susceptible in part because of higher rates of pre-existing conditions.
This viral pandemic is essentially intersecting with the epidemic of obesity, the epidemic of homelessness, and the epidemic of poverty.
We found many people worrying about exposure to the virus. You worry you're at greater risk, and are you taking all the precautions that you can?
Yes, I do. I have my mask, I have my hand sanitizer.
Oprah talking about solutions with NBC's Hoda Kotb.
One of the things we're talking about in the special is the need for more testing stations, obviously.
Though NBC's Ron Allen finding problems at a Brooklyn testing site.
This new center just opened to bring testing for the virus to the middle of a hard-hit minority community.
but it's drive-through only in a neighborhood where most residents don't have cars.
Oprah's message comes as she's donated $10 million towards pandemic relief.
For now, everybody needs to look out for themselves and for their neighbors.
A new call to action in critical times. Rahima Ellis, NBC News, Elizabeth City, New Jersey.
Now with a closer look at one of the most dangerous yet underreported aspects of this pandemic, the rapid spread of COVID-19 in prisons. This New York Times headline captures the dilemma: jails are petri dishes. Some states have taken steps on their own to mitigate the risks. Late Friday, Attorney General Barr called for the transfer of inmates most vulnerable to home confinement, beginning with federal facilities in Ohio, Connecticut, and Louisiana, where 5 inmates have already died from the virus. And now there are new cries for help from one of the nation's most overcrowded state prison systems. ABC News has obtained exclusive video from inside the Alabama prisons. Take a look.
It's going to be a mass grave site up in these prisons.
This is a dormitory. We stupid crowded, we super crowded. Now, as you see, the folk walking down the aisle, and they got to turn and see, that aisle is too small. It is way, way too small. These are the beds. They right beside each other, and this is the space. Stretch your arms out again. That's how close we are. See, these are the people that they should be letting go due to the coronavirus. What in the world can this man do?
The sinks are very outdated. We cannot wash our hands simultaneously at the same time, you know. My thing to the outside world is help. Help. Help for the overcrowding, help for sanitary purposes, help for a release mechanism. We need to release some of these people. We need help.
Dramatic video there. We reached out to the Alabama Department of Corrections. They acknowledged that current conditions mean they can't enforce social distancing, adding that the department is working to do everything in our power to mitigate the spread of the virus. As of Friday, no Alabama prisoner had tested positive. A couple of prison workers have confirmed positive. And we're joined now by Dr. Homer Venters, president of Community-Oriented Correctional Health Services, former chief medical officer for the New York City jail system. Topeka Sam, a former inmate who spent 3 years in prison for a nonviolent drug offense, now a criminal justice reform advocate, co-founder of New Yorkers United for Justice. And Bristol County Sheriff Thomas Hopshin. He oversees 5 facilities in Bristol County, Massachusetts. Thank you all for joining us this morning. And Dr. Venters, let me just begin with you. Just give us a sense of the scope of this public health crisis in Americans' prisons right now.
Sure, and good morning. We have 5,000 county jails and state and federal prisons and probably another 2,000 juvenile detention centers and ICE detention centers. These places are almost perfectly designed and run in a way to promote the spread of this virus throughout these institutions, affecting not only the people who are held there, but the staff. We saw it in New York City. In just a couple of weeks, we went from 2 cases to 38 cases to now over 500 cases, split evenly between staff and detained people. And so the danger here is that we're not only really going to see the explosion of cases among people who are detained and the people who work there. This is going to drive the entire epidemic curve for this nation up just when we're trying to flatten it.
And Topeka Sam, you've lived inside some of those facilities. Give us a sense of how difficult it is, we saw some of it in that video right there, to accomplish social distancing inside these prisons.
Absolutely, George. There is no such thing as social distancing inside of prisons. As you saw, the conditions are no different than when I was incarcerated in 5 different prisons around this country, in federal prison and county jails. That video is heartbreaking. You said it best first, that this is a public health issue. Mass incarceration is a public health issue. And now that this outbreak has happened, I'm happy that we're taking a look at prisons in a different way and the people that are actually in them. Unfortunately, as you see, there's no way to properly be 6 feet apart. There is no way to properly wash your hands. There's not enough soap. They can't use hand sanitizer because of alcohol products that are in them, and they're considered contraband. You have people, that was an open dorm, but where I was, there was cells. And in those cells, we were locked in sometimes up to 21 hours a day. I just received a call from Michelle West, who's in federal prison, and she actually is in Dublin, California, where they're locking the women in for 5 days out of 7 days. So they're only allowed out of their cell for 2 days a week, Tuesdays and Fridays, for 15 minutes a day to take showers, make phone calls, or just get some fresh air. This has to stop. We have to begin to release our people from prison, because not only is it the incarcerated population that's impacted, it's the officers, it's the chaplains, it's the workers who come home back into the community and then spread the disease even further within our community into their own children.
And Sheriff Hodgson, the question is, how do you balance those very real public health and safety concerns against the safety risks of releasing too many prisoners?
Well, good morning, George. That's a great point. Look, it's all about your protocols in the prisons and how well your staff are prepared. We've been dealing with H1N1 prior to this, SARS, all of those viruses. It's all about the control you have in your prisons. Now, if you let people out into the streets, 80% of our population have drug-related issues. They have compromised immune systems. So you let them out into the community, they're a higher risk, become carriers. They're going to start feeding their addiction. They have no support to get medications. They're going to have no rehabilitative programs out there. And they're going to be wandering into stores, under the influence of drugs, not to mention the fact that when they overdose, if some of them do, you have the emergency medical people having to respond. And then we've been worried about ingesting a particle of fentanyl, never mind the exposure to COVID-19, which will happen. The other thing is these people have nowhere to go. Many of them are going to go stay in apartments with 3, 4, sometimes 5 families in a 5-room apartment. I can't think of anything more dangerous. If we're talking about distancing, I can't think of anything that would be more distancing than have the prisoners in the jails protecting the people on the outside from adding more carriers and more exposure. We have the protocols in place. We have no COVID-19 people. We've been at this for a month. Most of the prisons, I think, except for one facility in the state and Middlesex County had 2 prisoners. Other than that, there are no prisoners, as far as we know, in our county systems.
This is such a difficult dilemma. I wish we had more time to look at it today. We will definitely revisit it, but thank you all for your time this morning.
Coronavirus is spreading throughout America's state and federal prison systems. I spoke to one man who's serving life inside a California state prison. He asked us to withhold his name because he has a contraband cell phone. He's in one of the facilities where a worker tested positive.
So this is what social distancing looks like inside a prison. As you can see, I'm filming the day room at the facility that I'm at. And as you can notice, there's a number of inmates freely walking about in the day room. So all it takes is just one person in here to become infected with the coronavirus, and it's a wrap. Everybody's going to be infected.
How in the world is this system going to deal with COVID-19?
All it takes is for one person to come into this environment that's infected, and boom, you got a crisis on your hands. And my biggest concern is it's not so much getting it from the prisoners, it's getting it from the correctional staff.
What are the correctional officers doing when they're coming in? Are they getting checked for fevers?
Well, I've been informed that they are being screened each day that they walk in. This is not one of those things where you can just simply ask if someone has symptoms and clear them to come into work into a dense populated area.
If you started feeling some of the COVID-19 symptoms, how long would it take you to see a doctor?
They have a nurse that's visiting the building every day. The problem with that is, I think for most prisoners, they would be afraid to report that, because it automatically is going to result in them being isolated in the hole.
In terms of the commissary, are you able to get Lysol wipes, bleach, anything to disinfect and keep your area clean?
I gotta laugh at that. Are you kidding me? The commissary don't sell nothing but junk food. You hear me? In terms of disinfectant, as a matter of fact, they have a limitation on the number of soap that you can buy.
So how are you supposed to wash your hands as often as we're supposed to wash our hands with just 4 to 6 bars of soap a month?
I think you just answered the question to one of the biggest contradictions. So on paper, it looks good. When you look at what their protocols are for this, they're talking about they're passing out extra soap, that they're doing extra cleaning, that they're passing out disinfectants of this type of and sort. Yeah, that's not the reality in here. This is what's happening right now inside the California Department of Corrections. We're sitting ducks in here.
I reached out to the California Department of Corrections and Rehabilitation. A spokesperson says she cannot answer my questions without knowing which facility the inmate is in, but we agreed to his request to not reveal that information. I then sent more general questions about protocols for the entire prison system, but have not heard back yet.
As the United States reports world record deaths and hospitalizations from COVID-19 in the final days of 2020, we look at how the pandemic that's ravaged the country this year has shown stark new light on racism in medical care. We begin with a now viral video recorded by Black physician Dr. Susan Moore and posted to her Facebook earlier this month, in which she describes racist treatment by medical staff at a hospital in Indianapolis who did not respond to her pleas for care despite being in intense pain and being a doctor herself. Dr. Moore says she had to beg to receive the antiviral drug remdesivir and pain medication and accuses a doctor at Indiana University Health North Hospital of ignoring her pleas because she was Black. This is Dr. Susan Moore as she summoned the energy to speak from her hospital bed days before she would die. She had an oxygen tube in her nose.
At that time, I'd only received 2 treatments of the remdesivir. He said, you don't need it. You're not even short of breath. I said, yes, I am. Then he went on to say, you don't qualify. I must have, because I've gotten 2 treatments. And then he further stated, you should just go home right now. And I don't feel comfortable giving you any more narcotics. I was in so much pain from my neck. My neck hurt so bad. I was crushed. He made me feel like I was a drug addict. And he knew I was a physician. I don't take narcotics. I was hurting. So I spoke to patient advocate who left me wanting. There's not much I can do. So I started asking, send me to another hospital where they can treat me. And if they're not going to treat me here properly, send me to another hospital. Well, next thing I know, I'm getting a stat CT of my neck with and without contrast. The CT went down a little bit into my lungs, and you could see new pulmonary infiltrates, new lymphadenopathy all throughout my neck. And all of a sudden, yes, we'll treat your pain. You have to show proof that you have something wrong with you in order for you to get the medicine. I put forward and I maintain if I was white, I wouldn't have to go through that. The other thing that white Dr. Bannock said was that if I stayed, that he would send me home Saturday at 10 p.m. in the dark. Who does that? On a weekend, who does that? This is how black people get killed. When you send them home and they don't know how to fight for themselves. I had to talk to somebody, maybe the media, somebody, to let people know how I'm being treated up in this place. And he gladly told me, I know you're a doctor. So he didn't want the black doctor to have no medicine, nothing. And then had the nerve to say it's because of him, the nurse, that I got the medicine. Really? Because of you? No. How about because I had that stat CT in my neck where it showed all of that lymphadenopathy and infiltrates? Yeah, you didn't know about that? You didn't get that in report? That's what I said. To being black up in here, this is what happens.
Dr. Susan Moore died due to complications from COVID-19 on December 20th, just over 2 weeks after she recorded this video and posted it to her Facebook page. She was 52 years old. Her 19-year-old son, Henry Muhammad, is now left to care for her parents, who are both suffering from dementia. The president and CEO of Indiana University Health issued a statement in response to her death, saying the technical aspects of the treatment she received, quote, may not have shown the level of compassion and respect we strive for in understanding what matters most to patients, unquote. Dr. Moore's chilling message has been compared to the video of George Floyd begging for his life as he was killed by Minneapolis police.
Hi, I am a registered nurse in Nashville, Tennessee, and my name is Kalila Mitchell. I'm reaching out to everyone about the COVID-19 vaccination. I recently took the COVID-19 vaccination. After the shot, I felt fine, but within 3 days, I went to the doctor because I had problems with my face. The whole left side of my face, actually. I have Bell palsy now. And as you can see, I can't smile. I'm trying to smile. I'm just kind of embarrassed. But I just want everyone to know that I think this vaccination is the worst thing ever. And I would not give this to anybody, even my worst enemy. Please, America, they do not care about us. Do not take this vaccination.
Well, there's a report from the New York Times that there's been a severe allergic reaction from a healthcare worker in Alaska after receiving the Pfizer-BioNTech vaccine. Now, they report that this person is in stable condition, but the person had been hospitalized after this allergic event. They are citing 3 people familiar with this event. I've reached out to Pfizer for any comment and have not heard back yet, but we'll report back. Now, they're saying that it wasn't clear if the worker had a history of allergies, but they said that the event appeared to be similar to the anaphylactic reactions that 2 healthcare workers in the UK had after receiving the vaccine last week. Now, you see Pfizer moving down there on this news. And guys, of course, this is something that the FDA and that health departments are monitoring as this vaccine gets rolled out, because we knew that after those 2 healthcare workers had these reactions, that this could be something that happens. And so the CDC has recommended that anybody who's had an allergic reaction to a vaccine or an injectable drug before not get this vaccine. Anybody with severe allergic reactions to anything else, food or drugs, should be monitored for 30 minutes after getting the vaccination. So guys, this report just coming out. We'll bring you any more news that we get on it, but that's the news for now.
Black Corona, Black Corona, Black Corona, Black Corona, Black Corona, Black Corona. Black Corona, not a virus. Black Corona's like a plague. Black Corona, it was made up in the lab just to kill the blacks dead. They said white people died.
Across this country, the nation celebrating the life of Hall of Famer Hank Aaron, a rare legend among legends. He became baseball's home run king, the first to break Babe Ruth's record, a champion of civil rights on and off the field. Here's Steve Osunsami.
He will forever be remembered for this mighty swing.
Straight away. Fastball is a high drive into deep left center field. Buckner goes back to the fence. It is gone.
That helped replace a white man with a black man in the record books. This was the call that night in Georgia in 1974 when Hank Aaron slugged his way past the legendary Babe Ruth with 715 career home runs, and his record of 755 would stand for 30 long years.
A black man is getting a standing ovation in the Deep South for breaking a record of an all-time baseball idol.
But it needs to be said that Hank Aaron overcame a whole lot more than a baseball record. He was heckled by racist white fans and players. People were promising to kidnap his children, and the death threats came pouring in the mail.
I couldn't open a letter for Ma. It had to be opened by the FBI or somebody else, I couldn't let that stand in my way.
Henry Louis Aaron grew up poor in Alabama, where he had to make his own baseball bats with tree limbs. It was when black athletes were lucky if they could make it to the Negro Leagues, which were separate and certainly not equal to the majors.
I played with some ball players that knew how to play the game, and they taught me an awful lot.
Mr. Aaron was unshakable, living up to the great responsibility he felt for how he represented black Americans. He became a successful businessman, gave millions to schools and charities, and just weeks ago was part of an effort encouraging black Americans to get vaccinated for the coronavirus.
It's just a small thing that can help zillions of people in this country.
In his later years, he would often say that he wanted to be remembered most for the lives he helped change.
I think that I want to be remembered as someone who was able to forget about baseball, but be able to help mankind.
Shitting down lungs, enlarged tongues, and they say it's just a side effect. And they tell you gotta take another shot, and the second shot may be worse than that. Nurse took a shot and faint. She couldn't even talk to reporters. They came back and tried to clear it up. Well, all them bogus ass stories.
I did, yes. So, all of my staff, we are excited to get the vaccine. We are in the COVID unit, so therefore, my team will be getting first chances to get the vaccine. And I know that it's really, I'm sorry, I'm feeling really dizzy. Oh, I'm sorry.
Guys, welcome to another video. Yesterday, I was seeing one of my patients in the pulmonary clinic, and she was asking me about my thoughts about getting the COVID vaccine. She also asked me if I heard about the doctor in Florida who died after getting the first Pfizer vaccination. So this is something I want to talk about. So there was an obstetrician, gynecologist in Miami who received the first dose of the Pfizer vaccine on December 18th. And shortly after receiving the vaccine, he reportedly developed acute immune thrombocytopenia. He died 16 days after getting the vaccine. His cause of death being a result of brain hemorrhage, or bleeding into the brain. Obviously, this is horrible, it's tragic, and you have to feel for his family. But it makes you wonder, was his death a result of the vaccine? And if it was a result of the vaccine, should that change your perspective on getting the vaccine? So I'm going to tell you my thoughts on this, but first, let's learn a little bit more about what happened. Pfizer is actively investigating the case, but they don't seem to think that the vaccine is the cause of this. So far, over 10 million people in the United States have received at least one shot of either the Pfizer or the Moderna COVID vaccine. These are the two authorized in the United States as of right now. Me personally, I received both doses of the Pfizer vaccine, which overall went very smoothly. Now, so far, there have been about 40 cases of anaphylaxis as a result of these vaccines, meaning a severe allergic reaction, none of which were reported as being fatal. Now, many people have had other side effects that are very common after the vaccine, like having a sore arm, having some fatigue, headache, or fever, and this typically lasts a day or two. The Miami-Dade County Medical Examiner's Office is investigating this death as well, and as of right now, there is no official autopsy report. But based off the reports, let's see what we can make of this case. So this man was healthy. He did not smoke, he did not take any medications, never had any reaction to any medication or vaccines. Supposedly, 3 days after he gets the first dose of the Pfizer COVID vaccination, he gets tiny reddish spots or petechiae caused by bleeding under the skin of his hands and feet. This prompted him to go to the ER. He gets blood work done, and his platelet levels are low, and this is something called thrombocytopenia. Platelets are one of the components of blood clotting. If platelets are too low, it makes people more prone to bleeding. Normal platelet counts range from anywhere from 150,000 to 400,000 or so. People can have spontaneous bleeding, including internal bleeding, but that doesn't typically happen unless the platelet levels are less than 10,000. His levels were reportedly 0, and because they're so low or absent, really, he gets admitted to the intensive care unit. For 2 weeks, doctors tried to get his platelet count higher, as he had experts from all over the country involved in his care. Now, presumably, they tried a number of different treatments. Typically, we give platelet transfusions, which is really a blood product that we're transfusing, but also we give steroids, specifically glucocorticoids, such as Solumedrol or methylprednisolone. If that doesn't work, we try other drugs like romoplastim or eltrombopag to try to stimulate the bone marrow to make more platelets. Sometimes we give immunoglobulins, sometimes we give a drug called rituximab, which is a monoclonal antibody. If all else fails, the last resort is to take out the spleen, because sometimes the spleen plays a role in sequestering and destroying platelets. So they were actually planning on doing a splenectomy, meaning removing his spleen, but shortly before that, he ends up developing a hemorrhagic stroke that took his life in a matter of minutes. In other words, he bled into his brain. Now, just because someone bleeds into their brain, it doesn't necessarily mean that they die. But what happens is, if the bleeding is severe enough, the pressure starts building up inside the skull, and this is known as raised intracranial pressure. And this compresses the brain, and eventually the pressure forces the brain down through the base of the skull, that big hole at the bottom of the skull known as the foramen magnum. When this happens, the only life-saving option is emergent brain surgery, where a neurosurgeon does a craniotomy to relieve the intracranial pressure. But his bleeding was so severe and happened so quickly, it took his life. And his thrombocytopenia was not only severe, but it wasn't getting better despite all the treatments that they tried. And this leads to the question, why does a healthy guy all of a sudden get severe thrombocytopenia to the point of bleeding to death?
As states across the country emerge from this shutdown, some areas are already experiencing a significant surge in coronavirus cases. On Sunday, South Carolina reported a record 799 new COVID cases, breaking the previous daily record set just 2 days earlier. Here to discuss the state of his city is Mayor of Columbia, South Carolina, Stephen Benjamin. Mayor Benjamin, thank you so much for being with us. We appreciate it. And we know, like so many other cities, your city, Columbia, has seen thousands of protesters take to the streets over the past few weeks. What role do you believe these protests have played in the rise in coronavirus cases there?
I think the spike we're seeing now probably maybe more related to the Memorial Day weekend, but it's no doubt in my mind that we're going to probably see the protests of the last few weeks will indeed contribute. While the vast majority of our protesters are wearing masks, they're that socially conscious. The reality is that physical distancing is a much more effective tool to control the spread of the virus. So I'm concerned about the role that the protests, though the cause is just, and I'm so excited with the new era of young leadership we're seeing all across the country. we've got to be smart about what we do to protect this one temple God's given all of us.
Yeah, we just don't want there to be a medical price to pay in all of this. So what is Colombia doing to help stop the spread of the virus as you remain open for business?
We've been focusing on the TTSI strategy, testing, contact tracing, and supported isolation. We have probably this weekend upcoming, maybe the largest testing effort the state has seen happening here in Colombia. We've helped. Obviously, the other side of social distancing is that in the consumer-based economy, we've seen a rather challenging economic situation emerge. We've supported our small businesses while also putting into place some rules that if people want to reopen back here in Colombia, we've asked them all to sign a Resilient Colombia Pledge. We've had 215 businesses in our downtown alone make some commitments to some best practices that allow them to reopen safely. And hopefully we'll watch that number continue to grow. That's just over the past week or so.
Yeah, Mayor, you attended the city's $1 Million Man March for Justice. The turnout was great. You said you saw people wearing masks and doing their best to adhere to safety guidelines there. But is there a chance that South Carolina could shut down if you see those COVID-19 cases continue to rise?
I know that and I'll just be frank, just listening to the governor's statements, the political will on the statewide level is not there to do so. I mean, even in the wake of the rather significant rise we saw last week, the governor decided to open bowling alleys, as he was literally at the same press conference. So it's probably going to require cities and counties leading from the front again, just as we did earlier in the pandemic. And we're just going to have to make some really measured decisions.
Yeah, we know you've put in so much already, and we appreciate your time and your efforts there for your city. Mayor Stephen Benjamin, thanks for being with us today.
Thank you. God bless you.
Black Corona, not a virus. Black Corona's like a plague. Black Corona, it was made up in the lab just to kill a black dig. They say white people die, that's a fact too.
Yo. 228, stand up. Real deal, J Hill. Project Boy Collabo. It's a pandemic. Let go.
I got my feet on their throat. I promise I'm ready to go. Watch them, they choke. Pressure, I add a little more. No sleeping, you better stay woke like I've been here before. Watch how I go for it all. I know that they wishing I fall. Hell to the no. Promise I gotta get mine. They tell me that money is time, so I'm out on the grind. Too much energy with a story to tell. I let it flow like the 7 seas. Mad scientists created the deadly disease. Now they call it COVID-19. Ooh, everybody wearing masks. The government lethal when just killing with vaccine. Revolutionary war, I can see the hate that when the police demonstrate killing us black men. Legalize slavery, long line, it'll change. Fall out, but fill up that shit, they won't change. I've been around, I see some things. God kept me here for a reason, amen. I'm on a mission, I got the vision. Nothing can stop me from hell in my business. I'm from the 228 muddy water, Mississippi. You can't swim, you might drown. I would never set a nigga up. It's not a part of my character. I linked up with Project Boy. We killing our platform. We stood the fuck up. I rock with them positive vibes. On home than a motherfucker. I want my piece of the pie. Element of surprise. We took off on our niggas like the 4th of July. I'm chasing that dunny. I gotta get that bag. I depend on my own money. It's you to get shot where I'm from. It's a breach of security, not to have a gun. I'm out the gutter, the trench, the hood where I come from. Call it baby Vietnam. Living in perilous times. Revelation, no lies, see the signs. Friends turn to enemy. Mother get daughter, father get son. The world is on fire. Distracted by social media beef. They wonder why I smoke a lot of weed. Run on that purple. I'm standing 10 toes down. On my square in my circle. Yeah, is you really down with it before you say yeah? Bet where your eyes, nigga. Oh, I got my feet on their throat. I promise I'm ready to go. Watch them, they choke. Pressure, I add a little more. No sleeping, you better stay woke like I've been here before. Watch how I go for it all. I know that they wishing I fall. Hell to the no. Promise I gotta get mine. They tell me that money is time, so I'm out on the grind.